show. Well, we are launching a new series today called Care in Canada with the help of some fantastic experts. We'll be diving into the problems facing this country's healthcare system and exploring realistic solutions to fix them. And we're going to be starting that conversation today with a focus on primary care.
It has never felt more difficult to find a family doctor in this country. So here to help us get to the bottom of this issue is Dr. Tara Kiran, a family physician at St. Michael's and the University of Toronto, and the founder of Our Care Research Initiative. Welcome to The Social, Dr. Kiran.
Thanks for having me.
So, Dr. Kiran, you say that the primary care situation in Canada has gotten bad enough for us to call it a crisis. So paint the picture for us. How bad is it right now?
Yeah, so it is absolutely a crisis. We did a survey back in the fall of 2022 and found that more than 1 in 5 people reported not having a family doctor or nurse practitioner. And so translated to the population of Canada, that's more than 6.5 million people without access to what really is like the fundamental part of our healthcare system. And what's also was striking was that it actually varied by regions in Canada. So actually, if you live in the province of Quebec or out east in the Atlantic region, it was actually almost 1 in 3 people who didn't have access to that care. And so can you imagine like not having access to the foundation of the healthcare system? Of course, everything else is going to be falling apart.
Yeah. Okay, so the big question is like, how did we get here?
Yeah, I mean, so a few different factors. On the one hand, we actually have more people, so a growing population, an aging population, more medical conditions, more social issues. So more people to take care of, but also every person takes more time to take care of. On the other side of the equation, we also have like a health human resource crisis. So we don't have enough family doctors or nurse practitioners to actually meet our need. We haven't been training enough doctors over the last 30 years. We have actually fewer doctors per population than most of our peer countries. And then even the people who choose to go into medical school to become a doctor, fewer of them choose to become family doctors. And even if you train to be a family doctor, fewer of them choose to practice in family medicine. They'll use their degrees to do other things. And part of that's because, family medicine is not attractive because it doesn't pay as well as some of the other specialties, but it's also kind of run in this way that's, I think, kind of archaic. It's not a small business model. You're basically not just doing the doctoring, but you're running a small business. And you have to hire the staff, you have to, get the rent together. Business costs are rising, so that becomes stressful. Let's say you want to go on a vacation or you need to go on parental leave, you have to find someone else to cover for you. Like all of that is really hard, and so people are choosing other routes.
Fascinating. Okay, so you surveyed thousands of Canadians about their experiences with the primary care system. What kinds of patterns did you notice?
Yeah, so over 16 months, we heard from almost 10,000 people who collectively spent 10,000 hours with us or so. And it was actually really heartwarming to see how much agreement there was across the country in all of the different conversations we had. And one thing that was really strikingly clear was that everybody felt that every person in Canada deserved access to high-quality primary care. Regardless of background, regardless of where they were. And, I will also say, they shared some very common frustrations and solutions. So they were like, why is it that I can't have access to my own medical record? That should be the case for every person, right? And they wanted to make sure that in the future state, every person should have access to that record and be able to share it with their caregivers and with the health professionals looking after them.
Okay, so the solution sounds almost too simple. Like we need to invest in primary care. And I say this not only as a person, as a citizen, but as a taxpayer. Like we are paying major taxes. The expectation is I give my tax money to receive a service. So if 6.5 million of us don't have it, someone else is not holding up their end of the deal. I don't want to get too activist about this, but I'm very passionate about it. So why are we not already investing in primary care? We see that we need more doctors, period.
Yeah, so some of it is actually shifting how much we spend in kind of that preventive sphere. So, we heard from people saying that our system is too sickness-oriented. We need to make it wellness-oriented. When we look at total health budget, we see that we spend less on primary care than most of the peer countries that we look at. And that's a proportion of the total health budget. So we need more money in primary care. And I will say that when we get more money into primary care, there's more things we can do. We know we don't have enough doctors and nurse practitioners to go around, but let's say we invest in teams so the doctor could work together with a nurse and a social worker, pharmacist, and actually care for more people. That would be one way in which we could actually support everybody to get care, but it does take money.
Well, you also traveled to other countries to observe their healthcare systems. So are there any models that you feel like we should be looking to?
Yeah, so I had the privilege of traveling to both Denmark and the Netherlands and really doing a deep dive into their system. And in those countries, pretty much everyone has access to primary care. And I will say, like, the Danish system, to your point, is interesting. The Danes really, like, hold their government accountable for the money that they pay in their taxes. They demand good services. And so, for example, when you're in Denmark, you, as a citizen, should be able to go online on a website and be able to not just find a family doctor, but have a choice of at least 2 family doctors. That's the government's goal, right? And it's all transparent there. You can see who's open and who's closed, and so the government can monitor that. They actually have, a lot of accountability and organization. So it's like doctors, need to take on a certain number of patients, be open 8 to 4, see patients in a timely way, participate in after hours. And interestingly, though, they also fund doctors to be able to do that. So doctors make enough that they can hire good staff, but they actually make more than most specialists. So family medicine is a very well-respected profession in Denmark and is really the foundation.
We have two more questions we really want to get to. So we know that people in Denmark pay more taxes. When Canadians hear that, they get upset. So sell us on the reason why they might want to consider, even if it feels uncomfortable, paying more taxes.
Yeah, so I mean, these countries, Denmark and Netherlands, they do pay more in taxes. And what I heard from a values perspective, people really care enough about this issue that we need to have a public conversation. And I think when we do, people will say, yes, we want to pay to have public care, not private, because private, we heard people don't want to be able to have to pay out of pocket. They want care publicly.
Okay. While in the meantime, we wait for more solutions and progress in our healthcare system, what advice do you have for people watching at home right now who don't currently have access to primary care?
Yeah, so, we put up a lot of resources on our website. We go onto our website, and actually there's a Find a Family Doctor page, and it tells you, you can call Health 811 in most provinces and territories. It gives you the number to call. You get contacted with a nurse. The nurse, actually, if you don't have a family doctor, it can help you to navigate the nurse can help you to navigate where to go in the system, provide you with advice, get you on a wait list for a family doctor. But we also have other resources on our website, and importantly, I think it's really important that people get educated about this issue, and so we've got a great educational video there. And we also have ways in which you can then contact your elected representatives. We're coming up to an election. This is perfect timing to say, to all political parties, what are you going to do to address this absolute crisis that we have? Show me.
Dr. Kiran, thank you. Thank you. We're going to take a very quick break. We'll be back right after this.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.